Thank you, Christian, and thank you all for being here tonight. My name is Sanghyun Park. I'm a PhD student in Professor Giovanni Trevor's lab, who is also working in this building. And today I'd like to talk about one of my research projects on behalf of the team where we obtained this beautiful picture named Crystal Mosaic. So one of our lab's main research motivation is to support patients in achieving long-term drug adherence. As patients often fail to take medicine on time, still many medical problems stay unresolved, despite the remarkable advancement in pharmaceuticals. So one solution that gaining a lot of attention in this field is a long-acting injectable represented by in situ forming implant. This implant is initially a liquid form and can be injected through a needle in a minimally invasive way. However, once injected, they become a solid depot encapsulated drug in the polymeric matrix and achieve the long-term release of the drug. So this allows patients to achieve long-term therapeutic efficacy with just a single injection. However, what we recognized was that this system mostly primarily relies on polymer to extend and control the release of the drug, which actually compromise the patient's acceptability. Let me elaborate on this in the following slides. So from this generalized plot, you can see that clearly the polymer loading increased the injection force exponentially compared to the same amount of drug loading. This means while the polymer plays a crucial role in the system for extending release, but at the same time, they inevitably limit the available needle size of the needle for injection, mostly larger than 21 gauge needle. And I put this figure to give a sense of this significance. So please consider the right screen as a reference and imagine how painful it would be if you try to inject something into your body through a 16 or 18 gauge needle. I'm pretty sure no one in this room would enjoy that experience. And besides, there has been many efforts to realize self-administrations for improved patients' convenience and acceptability, but such a big needle could be an even more significant problem for such self-adjustable applications, given the risk of traumatic experience and safety concerns on patients' end. So to overcome this intrinsic problem in injectable, our team has been developing an advanced long-acting injectable where the primarily focusing on how to minimize the dependence on polymer. So in collaboration with Bill and Melinda Gates Foundation, we specifically aim to leverage this work to support people in sub-Saharan Africa to address their family planning issues by providing long-lasting, self-administrable contraceptive options. Now let's talk about the strategy. Our drug of interest, levonorgestrel, is a hydrophobic molecule, and the dissolution kinetics of its crystal form is primarily governed by surface area. So, if you inject without any polymer, and if you inject this crystal under your skin, then the duration of release will be comparably short as that of a single crystal. So we figure, what if we are able to derive their compaction upon injection so that we can minimize their surface area and also extend the release. So based on that simple insight, we propose an injectable system where the suspended crystals are assembled upon injection and became a compacted crystal structure at the end, by which we can achieve extended release with a minimized amount of polymer or even without polymer. So from our benchtop study, we discovered that compacting assembly can be derived through solvent exchange. With a partially miscible solvent, the suspended drug crystals is dragged toward the environment radially, while they're entrapped by the partitioning interface, which is receding due to diffusion. And therefore, the dragged drug crystals, along with the interface, is getting closer and closer over time. And at the end, they became a compacted drug crystal structure. And what matters is the solvent miscibility essentially determines whether the suspension can create a partitioning and receding interface with the environment. And depending on that, the suspension becomes just scattered particles or stay unchanged, like the top and bottom figure, or it can become a stiff solid implant at the end, like the middle figure, which can be even graspable with a tweezer. And if you magnify the Grasshopper depot, you can clearly see the compacted structure which was assembled over the solvent exchange. So to make this interesting finding the translational, we conducted a preclinical study with rodent models. So here we injected the lead formulations as well as its negative control where the crystals are dispersed in saline. And as you can see clearly, our lead formulation showed 2.2-fold slow release, more extended release compared to the control group. And more exciting part is when we excise the depot and analyze the structure using micro CT, we found that our lead formulation showed significantly higher packing fraction compared to the control. So in this work, with our lead formulation, we achieve higher compaction, lower surface area, and therefore we achieve extended release as we hypothesized. And another beauty of this approach is we basically achieve this extension without any polymer, which also enable the injection of such highly concentrated formulation through 28 gauge needle, which is 3.5-fold smaller than 18 gauge needle that I mentioned earlier as a typical size of the needle in the commercial products. So that's a condensed story and context about where this mosaic picture came from. This is another picture of the compacted drug crystals we obtained through solvent exchange. And based on the unique mechanism, we try to leverage this work to develop an advanced long-acting injectable. And from our animal study, we found that the more compacted structure from our lead formulation showed the extended release in pharmacokinetics. And also, thanks to the polymer-free formulation, we were able to inject this condensed formulation through a smaller needle compared to the commercial products. So hopefully, at the end of the day, we are able to advance this work to develop a self-administrable, long-lasting implant for people in Sub-Saharan Africa to address their family planning issues. So with that, I'd like to thank my advisor, Dr. Giovanni Trevorso, and my mentor, Dr. Vivian Fai, for all the guidance and support. And this is today I had an honor to represent this work on behalf of the team. So I thank everyone for their own contributions. And also I thank the sponsor and the affiliated institute for all the fundings and resources. And I really wanted to shout out the amazing research engineer in the lab, Benjamin Mueller, who actually took that picture and submitted this work to the KI Image Award and make this happen today. So a major credit should go for Ben, and he should be also the hero tonight here. So thank everyone, and thank you for listening.